And welcome. I hope everyone, the planetary meeting was amazing, and welcome to Harm Reduction. The beginning of the year. Happy 2021. Happy New Year's. My name is Tiare Sua. I currently work for the Maui AIDS Foundation, and I'll be your moderator today for this breakout session, which is Harm Reduction 101. I'm currently a prevention worker, and I've been in this game for a very long time. It goes all the way back to Kuleana Mamo days and helping transgender women. A lot of advocacy work there, especially with um, substance abuse trans people. Okay. So before we get started, I'm just going to kind of give you guys like a little overview of what harm reduction is. So harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. In today's world, we see the principles and tenets of harm reduction being applied in all areas of life. So this session will provide attendees an overview and understanding of the tenets of harm reduction. This session will also provide two dynamic examples of harm reduction being implemented locally and virtually. So our presenters are from Neighbor Islands as well as myself. So we'll kind of give you like an insight of like what we do in our neighbor islands and how we implement harm reduction in our practices. So participants will be able to list the tenets of harm reductions. Participants will have an increased understanding of utilizing virtual resources to implement harm reduction activities. And I'm pretty sure everyone who's logged in here has used some sort of virtual platform because we are in pandemic mode. And to me, it's virtually, it's great because now we can see everybody and we can kind of meet and talk about amazing topics like this. Participants will also have an increased understanding of implementing harm reduction services within the transgender community on Kauai. So that's one of our presenters from Kauai, Ms. Bianca Tasaka. I'm gonna have you guys introduce your guys selves. We'll start with Kikoa.
Hi, aloha everybody. I'm Kekoa Kealoha. I am an HIV medical case manager at the Hawaii Island HIV/AIDS Foundation in the West Hawaii office in Kona. I have been in HIV work for a little bit over 5 years in several different capacities. I worked in prevention first, and I moved into case management last year. So I'm very familiar with harm reduction as it applies to the work that we do and the work that happens throughout the community and throughout the state. Mahalo.
And if Bianca, you could introduce yourself, please.
Hello, my kaka. Good afternoon and good morning to everyone. I am Bianca Tasaka. I hail from Kauai Island. I am leading medical assistance as well as prevention specialist supervisor here on Kauai, and I work directly with our TGNC non-binary community, as well as doing our women's services and overall HIV, STD, and hepatitis services. And with that said, I hope you guys enjoyed this session today. Mahalo.
All right, thank you, presenters. So we got like really good presenters here who's gonna actually, because they are the ones who are on the front lines and work with our community front and center. A little bit housekeeping rules. So on the right side of your screen, there's gonna be like a little box where it says questions. You can go ahead and click on the ask question if you have any questions. And the one thing great about our session is that I get to interrupt our speakers. I love it, right? So anyways, I'm gonna start off with a question to all of you folks. And I wanted to know, like, what are you doing to support harm reduction in your work or personal life? okay? You can go ahead and use the ask button and type in your question. And without further ado, I am gonna let Kekoa take over. Go ahead, Kekoa, all you.
Thank you so much, Tiare. Aloha, everybody. I'm Kekoa Aloha again. Thank you so much for joining us today to talk story about harm reduction. Some of you may or may not be familiar with harm reduction. It actually is a little bit more common than you might realize. So I'll take you kind of through the history of it, the basics of it, and help you see kind of how it applies in our everyday lives and to the work that we do. So again, our three presenters are Tiare Su'a, myself, and Bianca Tasaka. And these are our objectives, as you've already heard from Tiare earlier today. So we'll share with you basic tenets of harm reduction. We're going to share with you kind of more creative ways that we do outreach and provide harm reduction services, at least on Hawaii Island and throughout the state. And then share with you best practices on Kauai. What is that line? Oh my goodness. Okay, so harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use, sexual behavior, and other health issues. It's also a movement for social justice built on a belief in and respect for the rights of people who use drugs and in who engage in other potentially harmful behaviors. In today's world, we see the principles and tenets of harm reduction being applied in all areas of life. So it's no longer limited just to drug use or sexual behavior and other health issues. And for those of you who are on the plenary just before this, you know, even the presenters in the plenary mentioned that harm reduction has broadened beyond just what we know. So some of the basic tenets of harm reduction.
I'm so sorry. Is everybody having issues with sound? If you can, please type inside of the question box that you can hear us because we don't want you to miss anything. Sorry, Kekoa.
No worries. I hope everybody can hear.
Can everybody hear us? I can hear fine. Perfect.
Yes.
Okay. All right, so the basic tenets of harm reduction, and this comes directly from the National Harm Reduction Coalition. So the National Harm Reduction Coalition considers the following principles central to harm reduction practice. So basically accepting that illicit and licit drug use are a part of our world. And we work to minimize its harmful effects rather than simply ignore or condemn them. It understands that drug use as a complex, multifaceted phenomenon that encompasses a continuum of behaviors from severe use to total abstinence. And it acknowledges that some ways of using drugs are clearly safer than others. It establishes quality of individual and community life and well-being, not necessarily the cessation or the stopping of all drug use, as a criteria for successful interventions and policies. Calls for the non-judgmental, non-coercive provisions of services and resources to people who use drugs and the communities in which they live in order to assist them in reducing attendant harm. It ensures that people who use drugs and those with a history of drug use routinely have a real voice in the creation of programs and policies designed to serve them. This tenet actually extends beyond drug use. All of them really do. But this one that I just read is a very important concept that we take into our work daily, which is nothing for us without us. We don't like program development that is supposed to serve us without representation from us in its development process. Next, it affirms that people who use drugs themselves as a primary agents of reducing the harms of their drug use and seeks to empower people who use drugs to share information and support each other in strategies which meet their actual conditions of use. Recognizes that the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other inequalities affect both people's vulnerability to and capacity for effectively dealing with drug-related harm. And lastly, it does not attempt to minimize or ignore the real and tragic harm and danger that can be associated with illicit drug use. Now, the most central tenet of harm reduction is about meeting clients where they're at. So come as you are. We do not make conditions on how people should behave based on what we think or what social standards are, and what social standards might deem acceptable in order for people to receive services. And that often means that people who are providing harm reduction services are seeing the most vulnerable and the most marginalized community members among us. And that includes houseless populations, not just people who are using drugs, people who are sex workers, and even down into people who are victims of human trafficking. It is a wide range of people that we serve. Now, one of the most common programs that people think of with harm reduction is syringe exchange services. Syringe exchange services, the Hawaii Health and Harm Reduction Center does have the oldest statewide syringe exchange program in the country. And as a result, these are bragging rights. Hawaii does have the lowest rate of HIV transmission through sharing injection drug equipment. So that is kudos to the CHOW Project and now the Hawaii Health and Harm Reduction Center for really spearheading this pretty revolutionary program. Illicit drug use, and especially injecting drug use, is associated with a lot of different harms. It can lead to damage to the skin, it can lead to damage to the veins, the introduction of bacteria, which leads to like MRSA or staph infection. And it also increases the chances of transmission of diseases like HIV, hepatitis B, and especially hepatitis C. Now, within syringe exchange services, there are a lot of things that are offered besides just the syringes themselves. Among this are the other works that are used for drug use, like tourniquets, cookers, cottons. And these are all things that have the potential to transmit disease. And so those of us who are in harm reduction often catch a lot of flack and are told that we are enabling community members when that's really not the case. As you remember from the tenets of harm reduction, we understand that drug use is going to happen. We just want to make sure that people aren't, injuring themselves or contracting disease when they don't have to, And harm reduction, especially syringe exchange, has been proven to not only reduce the chances of getting HIV or hepatitis C, Hep B, bloodborne pathogens, it also has been proven to reduce overdose. And a part of that comes from Narcan, which is naloxone, which is used to reverse the effects of opioid overdose. So drug use in itself can be pretty harmful, especially if people's behaviors become uninhibited. And just the manner that people use drugs in itself can be harmful too. Injecting drugs is potentially the most harmful. So part of harm reduction is, maybe asking people to change their behaviors if they're interested in doing that. Not as a service provider, we would never suggest that to a participant or a client. Of course, it would be client directed. If they were looking for safer ways to use drugs, instead of injecting, someone might suggest smoking because it is clearly less harmful. Now, beyond just drug use, kind of like what we talked about, harm reduction has brought into many different areas. And for those of us who work in the HIV field, we do know that harm reduction is also present in safer sex practices. Safer sex practices are harm reduction. The risk of sexually transmitted infections and HIV transmission can be effectively and significantly reduced with use of one or more safer sex tools like condoms, lube, and PrEP. Now, PrEP is a pretty revolutionary tool. It has been out for about 7 years. And for those of you who don't know, it is a medication that can prevent the transmission of HIV even without the use of condoms. So we do look at PrEP as harm reduction. Even if somebody is not going to use a condom when they have sex, if they're still going to have sex, PrEP is going to reduce the risk of getting HIV. So now harm reduction in itself, it seems a little abstract if you're not familiar with the HIV world or with people who may be injecting drugs or using drugs, but there are a lot of different examples of harm reduction in everyday life. Wearing a seatbelt while you drive is one of the most widely known ones because driving in itself can be a very dangerous experience. Putting on a seatbelt effectively reduces the risk of death if someone is involved with a car accident. Now, more contemporarily, we also know that harm reduction is present with the prevention of transmitting COVID-19. Mask wearing, social distancing, these are harm reduction tools because it reduces the risk that someone is going to get COVID-19 through interventions that are beyond just, the biology of disease transmission. So expanding harm reduction services has been an interesting and kind of novel experience because of COVID-19. Although I do have to give credit where credit is due, COVID-19 forced us to reprioritize and to really examine how we were going to provide services to the community and how the community was going to receive and access those services. So on Hawaii Island, I am a representative in the National Minority AIDS Council's Gay Men of Color Fellowship. Now, this fellowship focuses on biomedical HIV prevention. And so I have been doing a lot of work throughout the state of Hawaii using virtual meeting spaces to reach people who needed to learn about safer sex options, especially PrEP, PEP, and for people who are living with HIV, for U equals U, also known as undetectable equals untransmittable. Now, biomedical HIV prevention is harm reduction because it doesn't rely on chance, and it doesn't stigmatize, it doesn't dismiss the behaviors that lead to HIV transmission. PrEP accepts that sex is going to happen, and that sex, could potentially lead to HIV transmission, and that's where PrEP comes in. So therefore, it's a harm reduction tool. So this program itself was a driving force for renewing outreach opportunities in the time of COVID. I know when we first shut down in the state, and everybody was kind of like trying to figure out what was going to happen next, what the next restriction was going to be. And we pretty effectively kind of took our attention away from things that we should have been focusing on all along. This particular program forced, the outreach to happen even when people were still kind of uncomfortable and unsure of what was going to come next. This particular fellowship, we used incentives to increase recruitment for the different program participants across the whole state. We used existing local relationships that can be leveraged to reach national program goals. And so what that means is this program I'm a part of is a national program, but we only get it done by working with each other and doing outreach with each other. This particular program, I worked with Tiare Su'a at Maui AIDS Foundation. I worked with Colin Koshimizu at the Hawaii Health and Harm Reduction Center to bring this training to people in their communities. And it's those partnerships that really make recruitment work. So the fellowship invigorated participation in the cohort, which just means that, me and all the other participants who carried out this program in various parts of the country, we stayed connected and we were able to troubleshoot things that people were having trouble with in different parts of the country. And, what works in Hawaii doesn't always work everywhere else, but that's okay. It's all about networking and sharing the ideas. And this particular experience really helped to shape program development and adaptability due to COVID-19. So what we learned from utilizing online outreach beyond even just that program is that online outreach platforms allow service providers to reach community in real time and remotely. The virtual movement is the way of the future, so we've just got to get comfortable with technology, and we have to make services mobile and malleable. Online outreach also became effective with testing and with syringe exchange and letting people know that that services are still available and that they can still come. Even with the restrictions that restrictions due to COVID, we still were able to provide services, and that's kind of a testament to the adaptability of staff here and across the state. And it's all because we have a harm reduction mindset. We understand that things are still going to be happening in our community. We know that people are still having sex, even though they should be social distancing. We know that people are still going to be using drugs. And there's a particularly high risk of that right now, especially with all of the social conditions because of the shutdowns. But that's kind of a snapshot of what's happening on Hawaii Island. And I am now going to pass it over to Bianca on Kauai.
Aloha, sorry for the technical delay.
Thank you, T.
Just figuring it out. Sorry, Bianca.
Aloha,
Just a,
thank
just
you.
a real quick, Bianca. Just a quick little thing about the chat box. So if you minimize your screen, then you can see the chat box on the side on the right. So if you're in full screen mode, then you can't really see the chat box that's going to be on your right. Just like a little housekeeping. Okay, sorry, Bianca, go ahead.
Thank you, Tiare. With that said, I'm just going to share a little bit about how I support our community here on Kauai with our TGNC support and networking here on island of Kauai. So we definitely have a great mobile outreach unit that services our community here on island. We do definitely go out to different spots on the island. We provide certain tests such as the HIV testing, counseling, STD testing and treatment, syringe exchange, as Kikoa speak about HR services, condom distribution, smoking cessation program, which we offer patches, gums, and lozenges to those individuals that want to engage or utilize those services, as well as women's services, birth control pills when our nurse practitioner is available on our mobile unit, as well as pregnancy testing and trans services or HRT services. And if we can't get all of them on our mobile unit, we'll refer them back to our clinic for better service in our Lihui clinic on Kauai. We have been offering some COVID testing during this time. But with that offering services in our mobile unit, we had to make sure that there are certain requirements that are taken to make sure everyone gets the ample care and services that they need. So there was certain things that is needed or qualified to utilize our COVID testing services, which is a form of ID, picture and phone number, so we can definitely get a hold of them with their results. Insurance was not needed. It was mostly covered by Malamapono Health Services. And if those had insurance, we utilized their insurance as well. This testing period was partnership with Dr. Hillsland at Kauai KMC and the Westside Pharmacy of Kauai to the unsheltered communities of Kauai. Tests were self-administered or unassisted if needed available. Our outreach testing, like I was saying prior, was from the North Shore Hanalei area to Kekaha, which is the west side of Kauai. Results would turn out to be in 3 days. So we would go out on a Wednesday, results would come back the next day, and we would give results back the Friday of the results or the test that we did on a Wednesday. So there's a great result time with doing the COVID testing that we're partnered with as well with clinical laboratories. Also, we offered great waters and snacks for those clients that wanted to access those services of COVID testing. We did about 62 testing in the outreach services area and public encampments to those individuals that wanting to receive testing. Out of those 62 tests, we only had 2 that haven't gave results due to moving or different other things that might come up in case of incarceration or other things like that. We do offer some housing assistance, especially mostly for our HIV clients. And obviously there are certain requirements that are needed for those that are utilizing our housing assistance program. And also for some that are affected by COVID-19, such as job and financial. We do help with rental subsidization due to unemployment, but there are requirements that are needed to qualify for those housing assistance through Malamapono Health Service. We also do in-house services in our wonderful clinic that we just did. I stumbled. Our new clinic in about a year already. So we're offering great services to our community, such as transgender wellness, HRT, women wellness, PrEP, PAP, breast exams, birth control, hepatitis C testing, and services such as vaccines, STD testing and treatment, as well as HIV testing, PrEP, pre-exposure prophylaxis services, syringe exchange as in-house as well as in our mobile unit, smoking cessation as well as our mobile and in-house, hepatitis C coordinary care coordination as well as HIV and AIDS case management. We do have a food pantry for qualified clients, such as our HIV clients that need extra help and stability. And we also have a great drug assistance program that helps any of our clients that want to reduce any substance or want to get into a starter program. We have great service providers here that would definitely help navigate from a test that we do to integrated services such as drug assistant program, smoking cessation. So these are great ways to have a one-stop shop here for our services on Kauai, as well as the housing assistance that I went over earlier, and then community education and outreach services and programs to Kauai. As I was talking earlier, our services that we provide is for everyone, but I like to focus my services on my transgender, non-binary, and non-conforming community that we need extra support and services for them at this time. So with our mobile unit, we can definitely go out and supply and have those services available for them. I didn't realize that my business card would be definitely so important at this time to individuals that need ongoing care and services, so we can get a great communication and rapport with those. What's the one thing great about our mobile unit, because I'm really awesome and stoked about it, is that we can go into the community and offer the services in a culturally sensitive way, that we have rapport with the community and these places that we go to utilize outreach services on Kauai, where we got great COVID testing from and STD testing, as well as ongoing smoking cessation program for those individuals that are utilizing our program. Also, I want to state, with our COVID testing here on Kauai, we do have surge testing that is available on Sundays at different locations from 9 to 3. So if anyone is looking to get tested or any questions, do look to the Department of Health on Kauai or free surge testing on Kauai, and there are areas that are available for testing. And with that said, I am really a quick person. If you have any questions, do let me know. This is my information. You can reach me at bianca@mphskauai.org or mal@mphskauai.org. Thank you for your time and patience today, and I'm willing to ask any questions if needed. Thank you for your time and patience with me today. Mahalo.
Hi, everyone. Thank you to Bianca, and thank you to Kekwa. And of course, she's behind the scene. Thank you to Allison for kind of navigating us through all of this experience, as this is my first time moderating. So I see we have a question. So we kindly ask that all participants to complete the evaluation that will pop up 15 minutes after our session is done. Okay, so don't forget about those. But we do have a Q&A that I would like to kind of ask the presenters. So as a result of COVID, changes were made in program delivery. Is there a change you are going to keep even after returning to some normalcy that supports harm reduction? If we can unmute our presenters.
Hi, aloha, everybody. Yes, that is a really good question. So because of COVID, we had to shift to, when we did reopen for regular testing services, we had to switch to an appointment-based service. So that's probably one of the bigger changes that we are going to keep. So for HIHAF, what happened for us is we actually launched a sexual health clinic. We have a medical director now. And so we diversified our services and we expanded services, and it forced us to get more organized with how we do things. Previous to COVID, we were always doing testing on a walk-in basis. There are some things that we can't wait to go back to normal for. One of those is syringe exchange. Right now we're doing syringe exchange at the door because we cannot screen them every time they come into the office. It's a little too high volume. So we do our syringe exchanging at the door. And when we're able to reopen and let them back in, we are definitely going back to that because we don't believe that our syringe exchange participants deserve to stay at the door. They deserve kind of the privacy and the intimacy that they've had before COVID. And that's been a sacrifice of COVID. But we are gonna keep maintain appointment-based scheduling for testing services and other prevention services. It just goes smoother.
Thank you, Kekwa. Bianca, do you have anything to add to that?
Yes, Tiare, I definitely think that the appointment schedule is definitely something that is definitely what we already had in place already, but also the overview of our testing services and going through that on the phone to making it an easier process for clients that come in for services, to make that an easier flow for them, as well as in-house here doing our COVID screening, our testing, and making sure there's not too much people in our room at the same time, or keeping distant, and making sure everything is, you know, provided as needed, and our services is as accurate as we can do during this time of COVID. So thank you.
Tiare, I have one more thing to add, I'm sorry. And this is a big one. One thing that we are sticking with also is virtual outreach and virtual trainings, because they have proven to be a fairly low barrier. For people who are joining a Zoom session, I mean, by now, all of us are very accustomed to Zoom, but even our houseless participants in our syringe exchange program, even they have phones. And if they don't, they know how to get one. And they also know where Wi-Fi spots are in town, even if they can't activate their phone. So some Wi-Fi spots in town are like car dealerships or like Starbucks, for example. So people have access to Wi-Fi. And a lot of times they have access to phones and technology. So as long as someone has access to connectivity and to technology, virtual outreach, virtual trainings, and virtual events are relatively low barrier, and give people a sense of anonymity that allows them to be a little bit freer with how they receive and access services.
Thank you. Thank you, Kekwa. So we have a question from our participants. One of them asked, how do the houseless sweeps impact your outreach? Do you plan outreach around the houseless sweep enforcement schedule?
That is a great question. So we haven't been able to do in-person outreach in a while, but we have, and we will likely continue partnering with the West Hawaii Community Health Center to do community-based outreach where they go into the camps and bring healthcare and services to the different people who are living out on the streets or in different encampments throughout town. I have not seen a schedule for the sweeps lately, but I know that when they happen, we do get a lot of people coming to us, and what they need tends to shift. We are a fixed site for syringe exchange, so they come to us and we don't necessarily go out into the community. But usually what will happen is they'll come to us and they'll need a blanket, they'll need clothes, they'll need food, because everything that they've had has been tossed by law enforcement. And usually without regard to what they're going to do, and without regard to the fact that this is their means for survival.
Would you like to add to that, Bianca?
Yes, that does occur here on Kauai at times. I definitely do know that having rapport with those certain gatekeepers that definitely kind of like oversee those encampments or unsheltered individuals in those areas, like I have, is a great way to make sure that those people have those services that they need. Sometimes it's not the services that we provide all the time, but there are other ways that we can refer out services for those individuals that need those blankets, that need the extra hygiene care, such as Salvation Army or Catholic Charities, so they can access these type of services that maybe we can't at that time.
Thank you for that, Bianca. So we have another question from one of our participants. So this individual is from Philadelphia, PA in the house. So his question is, we have been hands-on throughout the pandemic, being the heroin and fentanyl hub for the entire Northeast corridor. We are trying to use technology, but the majority of our clients have no technology readily available. What would you suggest for us to help use technology?
That's a good question, and kind of a challenging spot to be in as a service provider. I think if they don't have access to technology, getting them access to technology is going to be kind of difficult. You'd have to identify people. I'm trying to think of what the name is. We'll call them the Obama phones. When phones became available to people for free, and we had service providers who signed people up for that program and got them the phone and the plan so that they were able to be connected. I think it's Blue Jay Wireless now or something like that. I'd have to look it up, but there is a program for it. If you can connect with a service provider who is taking care of that program and partner with them to do outreach, that would be a really helpful way, or build your capacity to be able to sign them up for that service yourself. I don't know. I know it's hard. It's hard being overwhelmed when you have so much to do and not enough time and not enough hands. But if you are able to provide that service, that would be great. Otherwise, if you are in person, in person is much more valuable than technology. Honestly, if it works, stick with it. But otherwise, that might be a way to expand is with the Blue Jay Wireless, or finding like a homeless outreach service provider. They might have access to technology and other services that you might not. We partner with Hope Services here on the Big Island, and they connect people with like IDs, social security card, birth certificates, things like that, so that they can get these basic things.
Anything you want to add, Bianca?
Yeah, that's great points, Kikoa. Here on Kauai, we definitely have great co-conspirators and advocates here on island that definitely help us navigate those clients into a flow that's easier for them because it's hard at this time. So we do have Kauai economic opportunities that definitely help them, like what Kikoa was saying, and in those type of services that we not provide at this time, but we can definitely refer them to those services providers that do provide those services. So it's great to have that collaboration with other ASOs and CBOs on the islands at this time, especially because it's great for our clients to receive those appropriate services that they are asking for.
Mahalo for that. And yes, like virtual and coming up with ways, trying to be inventive to service our community is really important too. So whatever people are implementing into their practices due to COVID, right on, keep pushing. Next question. How do balance meeting deliverables with COVID and harm reduction?
Oh, that's a good question. So, for those of us who are service providers, a lot of times we're bound by deliverables, right? We have to meet reaching certain amounts of people, certain, who meet certain criteria. And COVID has really thrown a wrench into that, because we can't see people in person and gauge, demographics of that person through regular interaction. Right now, our focus has been online outreach. We've just started to get back into the field. There was a fundraiser put on by our local bar here, our local gay bar, this past Sunday, and it was Drag Queen Bingo. And so that was a great outreach opportunity, and to get some of our newer prevention workers out into the field. But in order to meet deliverables, what I have done in my agency was partner with the other agencies to recruit members for participation in that virtual training. So I didn't rely just on what I could do. I have connections in Hawaii. All of us in Hawaii have connections, and we can help each other recruit. I had Tiare help, she recruited, I think it was like 10 participants for this particular program. Colin recruited, I think, about 15. We're never alone. We always do things together. And so meeting deliverables is really just finding where our networks are and utilizing those networks.
Bianca, would you like to add on?
I think for me, it's really simple, as just being consistent and available for those individuals that need access during our work hours. That's how I know I have gained rapport with those individuals, and they also come back in to seek services again in the future.
Thank you for that. And deliverables, yes, one of the important things as a service provider. So we have another question from our participants. What needs to happen for more service providers, namely state agencies, to take on a harm reduction approach? Great question.
That's a really good question. I think the first thing that any service provider has to do is to suspend judgments, to not hang on to any expectations of, clients and program participants, patients, and things like that. Harm reduction is all about understanding that, it's not only client directed, but it's, the client is the one who is ultimately responsible for making their decisions. It is never a goal of harm reduction to get somebody to stop using drugs unless that's what they want. Because we look at, like, for example, with drug use, we look at it as a public health issue. We don't look at it as a criminal issue or as a morality issue. It's a health issue. We accept that sometimes people are not going to stop using, and that doesn't mean that we turn away services from that person. When it comes to sexual health, it's, we have to understand that people are going to engage in behaviors that could lead to HIV transmission. And that doesn't mean that we stop testing them. It's giving tools to somebody and letting them have the autonomy to, make the decision for themselves and what they do with that tool. I can give someone a condom, I can get them access to PrEP. Whether or not they use it is up to them. And when they come back to me for a test, if they happen to seroconvert and have HIV, I'm not going to treat them any differently. I'm just going to provide a different service. And to me, that's what harm reduction is about, just not being judgmental. And the stigma is what drives people away from services. And if we are telling them that they have to behave this way, we're stigmatizing that person, and that's entirely contrary to what we're trying to do with harm reduction. So first I would say suspend judgment. And then after that, let the client decide. It's their life.
Thank you, Kekwa, for that. And just to kind of add on a little bit, I'm sorry, Bianca, go ahead.
I just want to say, you took the words out of my mouth, Kikoa. That is a perfect explanation of that. Thank you.
Yes. Also, like, to answer that question too, is we keep on forgetting to talk about implicit bias. So if we take out our implicit bias or work on our implicit bias, then harm reduction should come easily in your practice. For those of you who don't know what implicit bias is, basically it's how our brains are manufactured to already think about something when it's completely the opposite. So just kind of working on that. We have another question from our participants. So what does a Hawaii with a harm reduction framework look like? How would our healthcare, housing, and services look like?
I love that question. So whoever asked that question, thank you. Hawaii with a harm reduction framework looks like people housed. It looks like people off the streets. It looks like people being able to get healthcare regardless of their state. Healthcare providers, housing providers, and community service providers, we should not be making our services conditional based on where someone is at. Like for example, a Hep C provider should be considering, or should not make stopping drug use a condition of getting treatment for hepatitis C, because that leads to a poorer health outcome. We shouldn't make sobriety a condition of housing, because not everybody is able to achieve sobriety. And there are many people who can, and I know that this might sound unusual, but there are a lot of people who can do drugs and hold a job and be completely responsible adults. It's not for us to decide whether or not someone decides they get housing or that they get healthcare. So to me, a Hawaii with a harm reduction framework means that we address the person first. It's about the person and what they need, and not what we think they need.
Thank you, Kekwa. Anything you want to add, Bianca?
I don't know. Kikoa is just, I don't know, the psyche or something is just saying everything that I want to say. But I think the overall perspective for me is just trying to make sure you're client-centered at all times. And that's just what we learned in our work. No matter what the situation is, their history or trauma, we always want to make sure we're culturally sensitive and especially client-centered at all times.
Absolutely. So basically client-centered. So we are like about 13 more minutes till our session is up. So we have just about one more question. And if you guys please feel free to ask us more questions. When our session logs off, it'll just log us off and kick us out. So it's fine. I'm having fun. Are you guys having fun? Anyway, so what are some of the challenges and solutions you embrace to support harm reduction services?
I think the way we can support HR is definitely, for me, because we're in a small area here on Kauai, is always making sure I'm available for my clients at a reasonable time, that I can service my community, but definitely making sure that through this time of COVID, they are getting the right services and being treated correctly during this time, because everybody is so pressured, anxiety and depression can happen. So making sure that we always have some rapport with my clients here and always availability, and letting them know where we're at, what times we're available, so we can definitely get in touch with them and they can access the care services at those appropriate times.
Awesome work, Bianca. Thank you so much for that. Kekwa, would you like to add anything?
Sure. I think the challenges of COVID, are the same that everyone's experiencing. And the solution is not, so unusual. I think the solution is being patient and being objective and not taking things personally, because everything is so high tension right now. Whether it be with clients coming in to receive HIV services, testing services, or exchange services, everybody is at their wit's end, and as service providers, if we can separate from that, that personal element and not take things personally, be objective, we can do our jobs and provide the services that our community needs in a really respectful and impactful way. I think beyond that, you know, the solution is it always rests with us. We, as service providers, you know, we just trust yourself. I trust myself and I trust my coworkers. You know, we're going to do what's right and we're going to advocate for our people because it's what we do and it's what we do best.
Thank you, Kikwa. Yes, trust yourself. One more question to everybody. So I'm going to ask the same question again. What are you doing to support harm reduction in your work and your personal life? Because a lot of times, even if we're service providers and we're working, we also do stuff that is, we kind of implement our work into our personal lives too. So I mean, like whether we're talking to like our family members about sexual health, substance abuse, and all that other stuff that we do at work, there's always those times and those moments where we cannot separate from work. And it's a given because that's who we are and that's who we are as service people. So once again, what are you doing to support harm reduction in your work or your personal life?
Aloha. As for myself, you know, like I just stated prior, you know, making sure my community knows where to reach me, how to reach me, and the times to reach me. Um, you know, I think as for me, the form of harm reduction for myself in Hawaiian perspectives is hi'uwai. Hi'uwai is where I go to the ocean or to the water to cleanse my day off from what may have come upon me or the situations that I have dealt with daily. And that definitely helps me take care of myself, such as self-care or even meditate if it needs to be on the beach. But those are ways that helps me reduce harm and making sure I'm available for the people that I'm servicing.
Oh, thank you, Bianca, for mentioning that. You know, you touched on something very important. Culture, reconnecting to culture is a form of harm reduction because we know, especially for Indigenous people, we've been separated from who we are and from our roots. And they touched on this too in the opening plenary. But you know, our reconnecting with our culture and who we are is a form of harm reduction because it improves in self-esteem and it improves health outcomes just in general because of that. So yeah, connecting to culture is definitely harm reduction. For me, sometimes it's, you know, it's not eating cheeseburgers 3 times a week. Maybe it's once a week, you know, it's little things here and there. And it's all about making change in the direction and in favor of our health.
Thank you, Kikwa. We got like about 6 more minutes and we do have like quite a few questions that just popped up. So one of the questions are, what, if we can keep it kind of quick, what are the areas that we as a community group is lacking in harm reduction and how can we make things better?
I think the criminal justice system is extremely lacking in harm reduction. They look at it purely as a criminal justice issue, and I know that there are people within the system that are trying to change this, but to me, that's like the one glaring opportunity.
And for me, I think that's one out of the other one, which would be mental health services.
Thank you, Bianca. And we got like about 5 more minutes. So when we were talking about like the old Obama phones, somebody had mentioned, I think you can go to www.safelinkwireless.com. So one more question, Aloha, one quick question if you still have time, is needle distribution better than needle exchange? I think it was mentioned a couple times that a 1-for-1 needle exchange program was used. Could this lead to clients reusing needles?
So that's a good question, and it definitely, an exchange can lead to people reusing needles. In Hawaii, our state law is a 1-for-1 exchange, and we are bound by that law in order to continue providing services. Whether or not it's better, I don't have data available with me to answer that question appropriately. But we do get a number of people who come to us because they're seeking needles, not because they have anything to exchange. And unfortunately, we have to instruct them to bring us something to exchange in order to provide the service. But yeah, I mean, the more access people have to safer injection equipment, the better their health outcome is going to be and the less likely they will be to contract an illness.
Thank you, Kekwa. All right, so we got about 3 more minutes. So I'm just gonna take the time to just say, don't forget to please take your evaluations. I just got the signal that they're enabled. So as soon as you log out, you should have your breakout session evaluation. Please fill them out, submit them, and then other than that, I hope that everybody takes the time to utilize harm reduction practices in your future and start implementing it. If you do have any questions or any concerns, please hit up H3RC, or you can email me at tiare@mauiaids.org, and we can get your questions answered as soon as possible. Other than that, we are completed. Kekwa and Bianca, thank you so much. Allison, you're amazing with all the technical stuff, and especially for all of you who joined in this session, you are making a difference. Please keep doing you, and please doing frontline work and service our community. Mahalo for everything you guys do.
Aloha. Mahalo.